One member of the state's vaccine advisory work group is continuing to spread her message to get more shots in arms. And she's soon hoping to reach more people in underserved communities by treating the vaccination process like a Get Out the Vote campaign.
Good evening, everyone, and welcome.
These bi-weekly webinars are far-reaching, organized by Gayleen Knoyton to help educate people on the COVID-19 vaccine. As president of Celebrate Healthcare, Knoyton advocates for minorities and is continuing that work in her new role, sitting on Virginia's vaccine advisory group.
We are working hard to make sure everything is fair and equitable. And we want to make sure that everyone is educated.
Black, Latino, and Native American communities have been hit especially hard by the pandemic, and fewer people in those populations have been vaccinated compared to their white counterparts. The state now trying to make the shot more accessible to those disproportionately impacted by bringing the vaccine into their neighborhoods.
You can do mass vaccine distribution, but we need to get to the churches, the community centers, where people can walk right down the street and they can get vaccinated.
Dr. Danny Avula, who's leading the state's vaccination rollout, says limited supply may be a major hurdle now, but eventually it'll be earning trust among diverse communities.
At some point, the obstacle will be the hesitancy that exists in certain communities. And so we'll go from a high demand, low supply scenario to a high supply, lower demand scenario. And so we simultaneously need to do the continuous work of engaging those communities.
To do that, he says, health departments will need to partner with local organizations and faith leaders. Meantime, Knoyton is hoping to draw more people in by launching a Get Out the Vaccine campaign.
I'm going to start weekly calls with faith leaders. This is a huge undertaking. We need everyone at the table.
Getting more shots in arms, a massive effort that involves the whole community pulling together. Antoinette Delbel, News 3.